Loss of bladder control, known as urinary incontinence, is a major problem affecting people of all ages. It is especially common amongst people living in aged care facilities, affecting over 70% of residents. The health problems associated with incontinence include physical pain, increased tendency for falls, behavioral issues, risk of skin breakdown, and infections. Poor continence care has a negative impact on the quality of life of a resident. It can lead to loss of independence and embarrassment, all of which compounds low self-esteem, loneliness, and feelings of depression. Effective management of urinary incontinence is therefore important to promote the health and well-being of individuals and can reduce the costs associated with continence care by aged care facilities. Accurate assessment and individualized care planning are the foundations of good continence management. However, they are ongoing and the consistent practice is challenging. Most residential facilities rely on a manual urinary incontinence assessment. This typically involves a care staff asking a resident about their voiding episodes or manually checking clothes or continence pads every 1 to 3 hours. The information recorded is used to establish a time and volume bladder chart to determine the resident's level of incontinence and care needs. The failure to detect accurate voiding patterns results in an impersonalised and undignified practice where care staff are simultaneously taking groups of residents to the toilet at the same predetermined times each day. The solution to better continence management practice is Smart Incontinence Management. This is achieved through a sensor technology that provides an instrumented continence assessment and software to establish an evidence-based care plan. This automated process is more accurate and reliable by removing the guesswork and subjectivity associated with manual assessments. At the heart of this innovative continence assessment, urinary episodes are captured through a SIM sensor worn by the resident. The SIM sensor is then connected to a SIM pod, which links it to the facility's wireless network. In addition to the information collected by the SIM sensor, SIM supports the care staff with a point-of-care technology known as SIM Assist, which is an app displayed on various tablet devices. This enables the care staff to log observations about the resident's care during the assessment period. The SIM Assist can also receive notification when attendance is required. This frees up the care staff's time while ensuring the residents continue to receive around-the-clock attention. The information collected during the assessment is analysed by SIM software, which graphically displays the resident's bladder and bowel pattern, plus other observations. The care staff uses this information to develop an individualised continence care plan. SIM Continence Management Program provides a structured process from initial screening and assessing the resident's health profile through to establishing a care plan, implementing, validating the plan, and continuously reviewing the resident's health status. The aim is to support the restoration where possible of normal continence for a resident. Simavita's motto is gracing life. SIM provides a sense of dignity and grace to those with incontinence.